Well, hello there. I'm Dr. Jim, and I have been thinking lately about dementia, and that's pretty normal for me because I'm a gerontologist. And most recently, though, I wanted to write an article and shoot this video on the four most common types. There are a lot of types of dementia and a lot of causes of dementia, but I wanted to address the four common types of dementia. I wrote a decent article on it, and I want to share with you some of the bullet points. So it wasn't too long ago, you might remember these if you're older, if you're in your 40s, 50s, or beyond. We used to call dementia organic brain syndrome or senile dementia. Do you remember that? Those were like catch-all terms for cognitive decline, organic destruction of brain matter. And we now have different names for these things. So these are the four most common types of dementia. Number one, you know what it is. It's Alzheimer's disease. And Alzheimer's accounts for around 60 to 80% of dementia cases. And I have heard, and I've read, you probably have too, Alzheimer's is the long goodbye. This is a very progressive, long-lasting, chronic type of depression, of dementia, rather. And there are some early signs like short-term memory loss, impaired ability to focus, and a disturbed mood, and then it just starts to get much worse later in life. So, number two is vascular dementia. And always remember this, what is good for your heart is good for your brain. There is a connection between the two. Now, this type of dementia accounts for around 10% of cases. It's very different from Alzheimer's disease because it's caused directly by cardiovascular problems like mini strokes that lead to tissue damage or possibly bleeding in the brain. And there are some types, very specific types of symptoms that arise. Changes in personality will be seen quickly, disruption in thinking, inability to reason, the droopy face after having a stroke, paralysis, and body numbness. So it is, generally speaking, not progressive. Alzheimer's is the most progressive, irreversible neurological disorder there is. But vascular dementia is the second most common form, and it is quite devastating as well. The third type of dementia, one of the most common, the third most common, is frontotemporal dementia. And we are learning more and more about this. Now, it affects between 2 to 10% of people with dementia, and it is a consequence of the deterioration of the frontal and temporal lobes of the brain. It's very specific. One problem, a big one, with frontotemporal dementia is it is misdiagnosed often as Alzheimer's disease, but it's not Alzheimer's disease. So there are some symptoms that are associated with it, like behavioral changes, involuntary movement, which we do not see with the other types of dementia, an inability to plan, judge, socialize, sometimes shocking behaviors, a lack of emotion, weakened verbal and communication skills. So there are some very specific types of symptoms that we don't see with the other dementias. And my last one, number 4, and this is something we're learning more about all the time, Lewy body dementia. So the fourth most common type of dementia that affects roughly 5% of people with dementia is Lewy body dementia. This condition you might see named dementia with Lewy bodies. This is also underdiagnosed, and it's misdiagnosed for Alzheimer's disease. I guess several types of dementia are misdiagnosed or underdiagnosed. So experts describe this as a hybrid disorder, mixing symptoms of Parkinson's disease with Alzheimer's disease into one condition. Okay, so there are very unique symptoms. Unlike the other types of dementia, the primary underlying symptom of Lewy body dementia is visual hallucinations, but they are not troublesome to the individual. They don't cause stress. People with Lewy body dementia see small people, like children, or they see little animals running around. Sometimes sleepwalking and acting out dreams are also common, just like they are in some cases of Parkinson's. So there you have it. Those are the 4 common types of dementia. Stay in touch with me. Visit me at collinslearning.com, ceu.academy, and my blog, drjimcollins.com, where I'm always busy writing, publishing, and releasing videos. So take care, and I hope to see you soon.